I'm a family therapist, and I was at Virginia Tech for 20 years, and then now I'm at Kansas State University, and I'm a professor working in that area. How many of you do psychotherapy of some sort, couple, family, individual? So many of you, I heard earlier that many of you work in shelters, so maybe, or work with the domestic violence agencies, so maybe you do both. How many of you think that it is wrong, like not acceptable to work with couples together? It depends. I know it depends, but how many would say no, you never would do that? How many would say yes, that you have done that? How many of you have worked with couples? How many of you have ever worked with couples together where there's been violence? So many of you have worked with couples. I wanted to understand, for me, the context of who I'm speaking to. So already we've been talking, and we've spent this time in our study group talking about the idea that both men and women can be aggressive, and both men and women can be the primary aggressor, but they can also be part of a mutually violent relationship. So when I started doing this work in 1980, I didn't have that thought. I worked at a shelter, and I only thought men could be violent, so I didn't think that both women and men. And in the United States, the primary way that we addressed partner violence is through groups for men. And Professor Gondorf is going to close this session talking about where we are in the research and our thinking about working with groups of men. But that's been the predominant approach in the United States. And how many, do you have groups of men here also? Is that the predominant approach? Everybody's raising their hand, so this fits also. And in fact, in the United States, in 2008, 46 states had standards that require the judge, when somebody gets arrested, that they have a standard of what they have to do. So they call them batterer treatment standards, batterer intervention standards. And in about 60% of those states, they're mandated they do not allow couples treatment. It is not allowed when there's been an arrest. So by far, the standard has not been to do couples treatment, but part of my interest in understanding the issue of couples and violence is that I also direct a program training master's and PhD students to do therapy with couples. And I used to think that we don't work with violent couples, but then we did a study, and Dr. Holdsworth Monroe did a study, and other people did studies. They found that anywhere from 40% to 70% of the couples who just come in for couples counseling, that they have experienced violence in their relationship. So even though you might be a couples therapist, but you don't work with violence, you do work with violence. If you work with couples, it's there. And what we found so often is that when couples therapists said they didn't work with violence, that many times they didn't do a good assessment. So if they don't do a good assessment, and they see this lovely religious family, whatever, they think we don't work with violence, but they haven't really assessed for violence. So because I direct and train family therapists, it seemed important to me to be able to develop and test a treatment program for violent couples. And in 1997, I got funding from the US government, from the National Institute of Mental Health, to develop a treatment program for couples who want to stay together after experiencing intimate partner violence. But I understand, and I understand why couples treatment is prohibited. So I want to talk a minute about the controversy and why it's prohibited. Some people asked me if I was going to explain and train you how to use the treatment program, but he only gives me 20 minutes, so I can't do that in 20 minutes. So, but I would be glad to respond to email If you have my name on a list there, you can just do search on Google, find me. I'll send you some papers, some things that we've written to help you learn more about the approach that we use. Anyway, so why would we not use it? Number one is the idea that if you treat a couple together, the implication is you think that both partners are responsible for the violence. So if you have a couple and there's one primary aggressor, there's one person who is violent, say the husband is violent to the wife, if you have them come as a couple, you're suggesting that she has a role in ending his violence, or that she might be also responsible for his violence. Like you might with a child, the children are fighting, your sister hits your brother, and you say to the child, what did you do to cause him to hit you? So the therapy that, what did she do to cause him to hit? So the idea that she's responsible for his violence is not acceptable. So that would be one reason why you would not do this work, because you don't want to imply she's responsible. Another is the idea that in many times couples therapists want to remain neutral. So I see each side equally. But if there's violence, of course we have, if we have coercion, we have unequal power. There's also, you can be neutral in that I respect and appreciate the strengths that this man brings, and I appreciate the strengths that this woman brings, but I'm not neutral about violence. Violence is always unacceptable. So even though I might be violent, I'm neutral. I don't like her more than him, but I'm not neutral about violence. Sometimes people are concerned that maybe the woman has some hope, or the man has some hope that if we do couples therapy, the violence will end. So some of the writers who've written about this issue say, if you offer couples therapy, it might give false hope, because maybe the violence won't end, and maybe it would be better that the couple separates instead of come to therapy, because if you can't be sure, which of course any of us who do psychotherapy, we know we can never be sure that the work we will do will have in depression, in violence. We're concerned that maybe a victim, as Professor Holdsworth Monroe mentioned, maybe the victim would not be able to speak freely. Maybe they would be afraid that if they speak out, maybe they can criticize their partner. Maybe they would get beat up when they get home. Maybe they wouldn't speak, so you wouldn't have equal for a conversation. Or maybe they would speak and they might be endangered, because maybe they feel safe with me. They come to my office. The first time she mentions a problem that she's had in her relationship is in the office because she feels safe. Then she goes home, maybe he would beat her up. Or maybe the first time he complains about her behavior is in my office, and then later there might be retribution in response. And then a final thing that's a very big issue in the United States, and I don't know if it's such a big issue here, is the issue of being accountable. So if you are violent, that's a criminal action. So in response to a criminal action, you need to be held accountable. And so going to couples therapy doesn't feel to some people that that's really holding an offender accountable. So I'm sure you could think, if we had time, of other reasons, but there's many reasons for the prohibiting couples conjoint therapy. And I'm going to offer some suggestions for why you might consider couples therapy. As somebody I heard say, it depends, depending upon the situation, but we know that both partners often want conjoint therapy, that many of the couples that that we become aware of, that we see through our agencies, we know in our university clinic, in our private practice, there's been violence, but they want couples therapy. Sometimes I think it's not listening to the voice of the woman or the victim when they say they want that, and we may be paternalistic and say, no, you can't have that. So I think listening to the voice of the clients is like a number one idea in social work or in family therapy. What does the client want? So one reason you might consider doing that is because it's what clients want sometimes. Professor Johnson's already spoken about different types of physical aggression. So we have the situational couple, and that would be the couple where there's not an overall fear. You know, neither partner is afraid for their safety, for their life. If they speak up, they're not afraid of violence. These would be the couples that we would consider might be appropriate and acceptable for couples treatment. The couples that are more intimate terrorism, we would not consider. And so what I think of when I say an argument for offering it is looking at distinctions among couples. We wouldn't offer it across the board to everybody, but we would say, does this seem like a couple that's safe? And working to try to do a good assessment, to try to decide. Another reason we offer that is we might consider offering it as an alternative is that when we only treat it in the United States, it's pretty much most of the time men. If we only treat men, sometimes we have evidence in our own work, because when we started our work, the men had to be in the men's group, and then they had to start the couples program. We had women say that that was a very dangerous time for them. After he'd been in the men's group for that evening, he would come home angry, and there would be there would be price to pay from that. We have other men who say, you think you've got it bad, but you should have heard the other men and what they've done. All I did was, so there's a possible negative of just having the men together. We also, in our experience and others, but sometimes when the men learn some skills, for instance, the timeout, I think you're probably familiar with that, where you would, he might take a break and they might go separate, might use a T, separate. We had women talked about the men put them in a timeout, told them to go to their room. We had men who would be gone for 3 days, men who would move in with their girlfriend and tell their partner, I'm going for a timeout. So we think that teaching the couple together, so they both learn the same skill at the same time. These are couples who want to stay together. We know that many of the violent men that you might see in your men's group and many of the women you might see at the shelter, they have no interest in staying with their partner. Well, they wouldn't be appropriate offered. It wouldn't be, there's no logic in giving them couples treatment. But I'm talking about the couples who live together, they go home together, they have to make decisions as a family together. So if they can learn the same skills about timeout, about self-soothing, then they can support each other and both work to have a violent-free home. We know that we don't have a treatment program that's been effective for all. We also know that many times the role of women's aggression is ignored in men-only treatment. So if the woman is also violent and we don't teach her skills to reduce her level of violence, there's some data, in fact, I have a meta-analysis that the biggest risk factor for her being hit or for him being hit is the individual's own violence. So if I perpetrate, I'm more likely to be a victim. So if I don't teach this woman skills to manage her anger, her violence, I'm endangering her. And we also know that another big predictor of violence is conflict in the marriage, in the relationship. The couples live together, they have conflict. It seems important that at some time they need an opportunity to work together as a couple to deal with that conflict. You might choose to do it after they finish the men's group, you might choose a different approach, but if they're going to live together and there's an ongoing conflict, dispute, disagreement, they don't have skills to handle conflict, at some time that it seems really important. We know that many victims, as was also mentioned earlier, want to stay with their partner, but they just want the violence to end. We have data from our work and from others that couples treatment can be empowering to victims rather than disempowering, and that we also know that relationships can be improved. So we have couples in situational couple violence, lots of violence. It may be him to her, her to him, both people. And we've been doing this for 15 years, and we've seen many couples who've been able to reduce or eliminate violence. We have this program is being used in Mexico and other places in the United States and South America, and we've seen many couples who could end the violence. And maybe in your own work, some of you said that you work with couples where there's been violence. You've seen also the violence can end. So we negotiate a balance. We may, conjoint treatment of couples experiencing intimate terrorism may very well be dangerous. However, working with only one violent partner while ignoring the violence perpetrated by the other partner may also be dangerous. So there's a balance. So my guidelines that I'm going to real quickly give to you is that you need to do a thorough assessment. That's the number one thing that you also heard with Professor Holtzruth Monroe. That if either partner is afraid, and if they are afraid that if they come to couples therapy and that they speak honestly that there could be violence at home, they would not be appropriate for couples therapy. If the person who's violent is not able to accept any responsibility, they think it's all the partner's fault, she made me do it, then they probably need individual or group before they would ever begin couples treatment. They need to be able to say, yes, I did it, even though they might not take total responsibility. We also believe it's really important who the therapists are. So maybe not every therapist can do this work. We believe that it's important that therapists should be skilled in both working with high conflict couples and in working and understanding violence. So if you've worked at a shelter, you understand violence, and you have couples therapy training and experience, this might be an appropriate approach for you. If you never worked with couples, this is not the couples you want to start with. And if you don't understand intimate partner violence, then this wouldn't be appropriate either. We think it's really important that you have safeguards. In our work, we have a multi-couple group and we have single couple. We start with 6 weeks of pretty much separate treatment, so the men together, the women together. Every session we do a pre-group before the group. We do the treatment conjoint, then we do a post-group. We find out if they're feeling angry, how they're feeling. We teach them a meditation. Sometimes we've had to have a woman leave separately before we let the husband go. We have 2 therapists, co-therapists. So we have a lot of safeguards. Obviously, I can't explain all of them right now, but it's not just marriage counseling, where they might sit in there and do a quid pro quo, if you do this, I'll do this. It's not just traditional couples therapy, but it's with extra safeguards. I think it's important that ending violence is the focus of treatment. So it's not the only focus. We can also talk about, the mother-in-law and other issues that come up, but I think it's a mistake, and I'm concerned about there's violence in the relationship, they come to therapy, and the therapist doesn't even talk about the violence. No skills to use to end the violence, they only talk about the mother-in-law. This is a problem, the work that we're doing and that we're advocating, that we've got data on effectiveness, is about ending violence. And of course, improving relationships if they want to stay together. If they don't want to stay together, helping them leave separately so that both partners are safe when they choose to separate. And we also think it's really important that any therapist working with couples where there's violence needs to be a part of a coordinated community response. So I work with the batterer programs in our community. I work with the shelter in our community. I work with the larger mental health system, with the substance abuse treatment program. So I might refer to substance abuse. I might refer to somebody for medication for serious mental illness. I always have the shelter number right there so I can help somebody connect to a shelter if that's what's needed. So they're part of this domestic violence community, not an isolated therapist who doesn't know what's going on in the community. I think it's important that we, as you all, I don't know if you have standards or not, but that the standards need to be open to not assume one size fits all. Thinking about what you've heard today, we know that there's lots of different kinds of violence, and everyone doesn't need the same treatment. And we need to be looking at what would be appropriate for offenders when there's been a court involvement, thinking about what they are, and we also need more research to really help us understand, what is the comparative effectiveness of just treating a man when both partners are violent, or just treating a woman when both partners are violent, because we really don't have research on that. But we do know that in some cases, I believe in some cases, working with a couple together makes a lot of sense. So in some of we interviewed our couples, before and after many sessions, so we have a lot of quotes. So here's one of our women clients. She says, "There's not hardly anyone that would take a violent couple. I've called and you just get, if he needs counseling, call this number, not even churches. There's nobody that wants to deal with violent couples. All they want to say is, well, how soon do you want a divorce? Well, I'd really like to try to work it out first." And one of our male clients said, who had been to the men's group first, they, the men's group, can't really address relationships because they're only seeing one half of the issue. Their primary function was to persuade people to stop the behavior and give them tools to do that. The other side of that is that these people are involved in relationships, and there may have been something wrong with the relationship. Yes, it was a bad attribute of the guy's behavior, but there was something else there too, and that needs to, at some point, be addressed. And that's the stance I take, that if they're going to stay together, at some point, those relationship issues need to be addressed.